as part of Parkinson's Awareness Month, which is April, and we're still in April, thankfully. We've been trying to do some interesting things, some fun things. On April 11th, it was World Parkinson's Day, sort of named in honor of Dr. Parkinson's birthday, which is April 11th. So there's a Parkinson's tulip that was named in his honor. And so we ordered a bunch of tulips on the 11th, and we're handing them out to our patients that day here. And we've done a few other fun things, and a lot of folks here were at that Parkinson's walk in South Park, and that was nice. A couple of years ago, we had some patients sending in information on really fun things that they've been doing, whether it's making videos, whether it's making lamps, whether it's doing different things, and really focusing on, it's too easy to mourn the losses. It's much harder to celebrate the small victories every day. And so really trying to turn the focus into what are some of the great things that people are still doing. So we'll try to keep this very interactive. I'd like to introduce a few people. On one side, we've got David, Wayne, and Kirk. We're not going to share a lot of health information, but they're people that have been diagnosed with Parkinson's, and I've known all of them for years. And they're significant others on the other side. We have Jamie, Suzanne, and Melanie. So we have some questions we're going to kind of go around and ask the group and kind of have them share some of the sort of success stories, some of the things that they've done over the years to keep themselves in good shape, whether it's mentally, physically. What are the things that have really impacted them, things that they may want others to know. So, and then we'll try to take as many questions as we can. So glad you all could be here. So, to begin with, we always talk about the diagnosis of Parkinson's, and I've had patients come in here and say, I've seen the most wonderful doctors and they explained everything to me. It was scary when they told me about it. But because they took the time to explain what was going on and what I needed to do and how I could still lead a very healthy and productive life, I was okay with how things were handled. I've had other folks who've come and told me, well, the doctor popped in and told me, well, I saw you walking in from the waiting room and I have to tell you, you've got Parkinson's and here's a prescription. I want you to start and I'll see you in 6 months. That doesn't go over so well. So I think kind of understanding what everyone's experiences are and what works and doesn't work, I'm kind of intrigued, and maybe we'll start on this side of the room, but maybe with David. Can you tell us a little bit about the day you were diagnosed and how it was handled and kind of what was going through your head?
I was diagnosed 12 years ago. We were living in Chicago at the time. I had never met anyone that had Parkinson's, didn't know anybody. Like for the first 4 years after I was diagnosed, I don't think I ever met anybody that had Parkinson's. I didn't know very much about the disease. Therefore, I don't think it really affected me that much because I didn't know what to expect. I was working at the time. My symptoms weren't that bad yet. The neurologist I went to didn't diagnose me with Parkinson's. I had a little tremor in my foot, and he did an MRI, and he told me that I had a minor stroke, which turned out was not the case. And didn't like him, went to another neurologist that diagnosed me. So that's about it.
All right. Wayne, you want to share your story?
I was diagnosed in 2009. I was told prior to that I had Parkinson's, but the one that tested locally that would exactly state that I had Parkinson's. So I went to Duke to see Dr. Mark Stacy, and Dr. Stacy did a PET scan, and in 2009 he diagnosed me with Parkinson's. And I had a slight tremor in my right hand, which wasn't that bothersome, but it got worse. And 2014, I had my first DBS surgery done for my right side. In 2018, I had my second DBS surgery done to cover my left side. So it was, I heard it said that, you know, you admit that you have Parkinson's, but Parkinson's never has you. It depends on what you choose to do and movements and motions as you go through every day and the exercises, and later on other options that were made available to me through Dr. Iyer, and I embraced those and I'm doing much better.
I think Wayne hit on a great point that we always try to make. He made the point, you know, we always say that if you have Parkinson's, Parkinson's doesn't have you. And I think that's the important thing to remember. You know, you can be a victim, or you can be in charge of it. You can own it. You can be empowered and learn how to fight it, whether it's through medications, whether it's through therapies, whether it's just learning about how to manage the symptoms. So I think being proactive is really key. I mean, I've always been a big believer in patient empowerment. You know, it's simple to write a prescription and give it to people and say, all right, go take this and I'll see you in 6 months. But if you can really teach people, okay, here's how you can maximize your quality of life. Here's how you can slow progression, whether it's through exercise or other things. You know, by and large, I find that people do it. As long as you let them know that here are the things that you need to be doing, and most people do it.
Yeah.
So, Kirk, you want to share
Yeah.
your day of diagnosis?
It's kind of blurry. I really don't know what day it was, but I know I took a job at a different plant in 2008. And at that time I had some feelings in my right hand as paralysis. And we went to a neurologist and he said it was essential tremors. So, and then I think we went to another source and they did a spinal tap checking for an MS with it. And that came back negative. So we just over those two things, they determined that it was probably early onset Parkinson's. I went to another neurologist after that, and then we finally hooked up with you. And basically that's been it since 2008. I went on the recovery, and that's been a blessing. It's made a tremendous difference in my life. And so that's about it. I just retired in July.
Congratulations.
Having a good time at home right now.
Well, good. It's interesting. We hear this all the time, especially when people are younger at the time of diagnosis, when they see some tremors and they see other things. It's often misdiagnosed as essential tremor, which is a different condition. You may remember Katharine Hepburn had that famous voice, the shaky voice, when she had essential tremor. Often people are misdiagnosed with that early on. And it takes a couple subsequent visits and tests to sort of say, okay, no, this is a little bit different. This is Parkinson's. So I hear that all the time. And, I mean, it's at this point, because we don't have a treatment that will cure it, stop it, immediately, that short delay in the diagnosis, it's not the end of the world. It's a little bit disturbing because you kind of go down one path only to find out, okay, now we're going to go down a different path. But that's a very common story we hear. So just kind of curious, want to hear from the significant others, what was your reaction and sort of what was your approach to, okay, I've got to manage this. I've got to make sure I keep these guys in good shape. How did you approach it? So maybe we'll start over here with Melanie and work our way back.
I'm not sure I had the best answer. We walked out of the doctor's office and I said, well, at least it's not a brain tumor. And, it's like, I had known someone recently that had died from a brain tumor and her husband lived like 4 months.
Mm-hmm.
So to me, I'm like, we can deal with this. And so I remember him saying later on that, talking with someone, he said, well, I'm just having to learn that this is my new normal. And really, we've, that's the way we've treated it. He's just sort of continued living exactly like we did before. I remind him when it's time to take his medicine, or ask him, did you remember to take your medicine? And, so I think just learning about it was sort of like David. I didn't really know anybody that had it, and it's so interesting to find out afterwards how there's so many people, how prevalent it is. Yes, it sure is. And how everyone that has it is different. It treats everyone a little differently, but it's wonderful just to be around others that have Parkinson's and see that people are living with it and they're living well with it. And I'm just very grateful that we found that prior.
I think you made a great point. You're living well with it. Quick story. When my dad was in his early 20s in medical school in India, he was diagnosed with diabetes, and he thought his life was over, and he almost dropped out of medical school and crawled into a hole. And I think one of his professors grabbed him by the ear and said, "Hey, you know what? You're about to learn one of life's secrets." He said, "The secret to a long life is to get a chronic disease early and manage it well." And he said, your friends are going to be out partying and drinking and smoking and eating garbage all day, and you're going to be exercising and watching what you eat and taking your insulin, and you're going to outlive all of them. And he just turned 81, doing really well, and he took that advice to heart. And that's what I try to tell my patients. Parkinson's is nothing more than a deficiency of dopamine, like a deficiency of insulin. So if you look at it from that perspective, and we tell you to take your dopamine when it's time, we tell you to exercise a lot because we know that's what slows the progression. It's really just a frame of mind, and knowing that, you can manage this and you can own this. You can let it beat you up if you let it, but you don't have to. So I think that approach is, one of the reasons why, I selected the three of you to come and talk to us today, is because you've all found ways to, find, not only your new normal, but to find things that may have even been better than what you were doing before in terms of your approach and the way you look at your life. So I think that's a great comment. So Suzanne, you want to sort of share your thoughts?
When we left the doctors that day, it was almost like denial, even though we knew that was a possibility. But you just come out of there, and then Wayne went one direction, to go out of town for the week, and I went another direction. And how I kind of process things is to dig into it, how, read and everything, look at everything. And then when I realized that there was such an abundant amount of information, because as I refer to it as a snowflake disease, like Melanie said, that, there are no two people that have almost the exact same symptoms. So we've always been extremely positive people, and we just have tried to remain as positive as possible. And with Parkinson's, there are bad days, and there are good days, there are bad days, at least with us, maybe not with everybody, but with us, there are bad days, and there's no predictability. But we had to determine early on that, up until now, we have survived every bad day we've had, and we're going to survive this one. And probably one of my bigger challenges as a kind of a partner in this is, and I'm blessed that it is this way, is that especially early on, I had to say whoa a lot versus go. So getting Wayne up and his exercising, or his climbing up ladders, or chainsawing down trees, whatever it may be, that was not getting him motivated was not an option. And we've had many conversations about this, Dr. Iyer. So I was blessed, but it's finding that balance, because you want them to live their lives, you want them to be independent, but then there's this whole safety factor that comes in, that you have to, you have to come to terms with both of you and say, okay, yes, you can do this, but is this really the safest thing for you right now? And we've had lots of discussions, and it's worked out well.
I got a couple of trees that need to come down.
Hey, now. Come on.
Jamie?
So I feel like I'm gonna be a little bit of a party pooper here. Because when we first found out, I was floored. And like, I didn't really want to talk to anybody about it for like at least 3 weeks, other than you. We play Scrabble every morning. Lots of times we play at night. And so in the beginning of his Parkinson's diagnosis, we did words that had to do with Parkinson's. And we would crack ourselves up. But in reality, outside of us, I was devastated. And I mean, I'm sorry to admit that, but I was. But we lived in Chicago and he was still working. Then we moved back to Charlotte and he worked a little bit. His fine motor skills weren't good enough to work anymore. And so he quit working. And we made the commitment that I would be working and he would be taking care of himself. By that, we meant he'd be exercising. And I cannot tell y'all how wonderfully well he's done that. I mean, he plays pickleball, he plays tennis. He is working out, exercising every day, several hours. And it has made an enormous difference in his life. And then he had DBS surgery last September. And that's been really significant. So to sum it all up, I would say, truthfully, Parkinson's has changed our lives. But we are better for it. And we love each other and we're committed to his health. But it pretty much sucks.
That's a good, honest answer. And
I mean, it does.
yeah,
I think.
I mean, it's
Not all the time.
No, but I feel bad for him. I hate that he's going through it. Yeah. I hate it. I mean, he's been an athlete his whole life. And, I hate it for you.
Yeah, I think as corny as it sounds, I always hear the phrase, when life gives you lemons, make lemonade. So kind of with that twist on it, David, I know the tennis and the exercise has been sort of your holy grail. You want to tell us, how did you get yourself focused? How did you get yourself focused after the diagnosis to say, okay, this is how I'm going to take charge of it?
Well, I was fortunate enough, or not fortunate enough, I don't know how I'd put it, but I stopped working when I was in my late 50s, so really early, and focused on exercise. I'd been playing tennis my whole life, so I continue. I try to play tennis at least 3 days a week. I got involved with the Rocksteady boxing program at the JCC, and that's been wonderful. It's not only good exercise, but it's like a therapy group, with everybody having Parkinson's and the discussions that we have. Started playing pickleball. I even started playing golf again. So I usually do at least one activity a day, sometimes two. And we also have a really great social life. We have a really good group of friends that we get together with a lot. We play cards at least once a month and other games.
Which gives good mental.
And I think that's really been important. So we stay really active.
Yeah. And that's one of the things that really strikes me about you, and why we invited you today is that we always ask everybody, have you had any falls since the last visit? And with David, I was like, well, does it count if I was diving for a tennis ball? Or just your approach to being to socialization. It's always been about being part of this group or starting this group. And you guys throw awesome parties. And I've been fortunate enough to have been invited to some of them. I think what you do to not only better your own life, I think you're giving a lot of other people the outlet of Where can I go where I can be comfortable and safe and have a good time? And
Right.
you know, the young onset group that you're a part of, and I think you do a lot for those folks. And as much as you know, people say, well, you know, how has your healthcare team impacted your life? I think it's more important, you know, how have you impacted other people's lives, and how have you impacted our lives? And I think you've done a great job doing that.
Well, thank you.
He's fantastic. Sorry, I have to just say that, but he is such a good role model
Yeah.
for living well with Parkinson's. If it had been me with Parkinson's, I would have been, I'm not sure.
Just as good.
Maybe,
But
no.
he'd be supporting you just like he's supporting you.
Yeah, maybe, but I mean, he has just such a positive outlook. It's just amazing. Sorry, I don't mean to go on and on about him, but
No, it's important. I mean, you can't underestimate the power of positive thinking. You know, if you think something bad's going to happen, it probably will. If you let it. If you think something good's going to come out of this activity and you go do it, more than likely something good's going to happen. So
Yeah, and I've been pretty lucky on my physically. I mean, I had a double fusion in my back
mhm.
the year before I was diagnosed with Parkinson's. I've had fairly recently both my knees replaced. I've had DBS surgery, so I've had a lot of stuff going on to deal with. But everything I've done has helped.
Yeah. Well, Wayne, you know, tell me, how'd you know, one thing that strikes me about Wayne, you may not remember this. A couple of years ago, we were talking, and this is sort of, I think, during the pandemic. And, you know, during the pandemic, we were really sensitive to everybody's sort of mental health, if you will. You know, it was horrible being at home. We couldn't talk to anybody. Everyone was getting depressed. Everyone was getting anxious. And so I was asking everyone very deliberately, you know, how's your mood been? How are you feeling? How are, you know, on the inside, are you feeling this stuff? You know, how's your mood? And, you know, we know that, you know, 70% of people with Parkinson's will say that it's their emotions, it's their mood changes that are more disabling than their physical symptoms. They feel more depressed or anxious or apprehensive, panic attacks, you know, you name it. You know, dopamine really controls the emotional circuitry. So I remember one day I was asking Wayne about his mood, and he looked at me and said, every day is great. Some days are greater.
that's an awesome way.
And I don't know if you remember saying that to me, but I do. And that really tells me a lot about who you are and kind of how you approach things. So
So I was just going to say, when he mentioned his approach to it is every day is a great day and some days are greater than others. But I don't have any bad days. I'm alive. I'm able to get around. I'm able to do some things for myself, other things with the help of my beautiful wife. And life goes on.
and you have chainsaws.
Really.
Which need to come to our house, you know.
We're passing the torch in the church.
Yeah. Well, Kirk, tell me, you know, how did you get yourself kind of focused on how you were going to attack this and live your life?
Well, I just didn't, I kind of ignored it, really. I took the meds, and I figured this is like the new normal. I was working a lot, so I didn't take time for myself, which I should have, but I guess my kids bought me a bike, stationary bike.
So he's like, I guess I have to do this.
So I
They
jumped-
bought it for me.
So I jumped on the bike and rode, and I spent the pandemic working from my son's bedroom that he had already moved out, but my bike was right behind me, so it was right there in full view. So any Zoom calls, they can see my bike right there. But got a lot of questions about that. But anyway, I rode that bike for a long time, still do, probably not as much, but I tried to at least do something to keep me active. I didn't play any organized sports or anything, but I mowed the grass, I did this, I washed cars, whatever.
He's always in the
I'm always in the garage tinkering, as you well know. So I always have something to do, something to fix for my wife. You know, she brings something. Can you fix this? You know, well, I got something for that. I saved something for that. So anyway, yeah, I just that's really about it. I mean, just day to day. I think my work was good. Work kind of kept you going too. Company that I worked for was very good, very understanding. So anyway, yeah, we traveled. We didn't stop our travel. We like to travel a lot, so we go. We have 2 trips planned here shortly, but that hasn't slowed us
So
down.
Parkinson's has been my excuse to travel more because I don't know how long we'll be able to do it. So I'm like, okay, we have to go to San Francisco because we get walloped up and down the hills. And so, yeah, we went
to LA in January last year.
Yeah, we went to England last year. So, and we walk a lot. Yeah, so whether or not it's an excuse or not, I'm like,
You're having
okay,
fun.
where's our next trip?
Yeah. And during the pandemic, or maybe I think it was 2019 when it was Parkinson's Awareness Month, we asked some of our patients to submit videos or this or that, different things that you're doing that are interesting that other people might want to see. And we had one of our patients was making all these flower garlands and making animals out of fruit that she was cutting into pieces and little neat things. And Kirk has always been good with his hands, and besides having fun talking about German automobiles, he always brings different things to show me that he's been working on. Do you want to show the lamps that you've made? Talk about tinkering. This is a professional tinkering.
This is a dial phone. Some people want to yeah, I remember what those look like. Anyway, this was a lamp that I saw. It's not an original idea. It's one that I borrowed from the internet. But I put my own little quirks on it. The way we turned a little switch on the receiver. So you can use it as a desk lamp probably. And we came up with this little, you remember the old days when you had the the prefix of your telephone, your 7-digit number was something. It was some
like Liberty 405 or something
like that. And that was obviously the numbers. So we put Light Talk 8838834, which happens to be our the last word is our phone number. But anyway, that was my first foray into this side of things. But my other one is probably a little bit more impressive. I have also made one of these that had a brake where you could spin it around. More useful as a lamp. So, my next one's going to have when you do the dial, it'll flash maybe. So this one here is a 3-camera lamp. Okay, this is a normal light. I had to put 2 cords on this. I got two cords, and then this is my idea. Was I put the LEDs and all the whole.
You got to turn around and show the people how to.
Oh, the
colors.
And they flash.
Really
The white ones flash. That's cool. And it's all wired up inside. It's actually on it's a 12-volt automobile turn signal flasher. It's flashing with lights.
Tell them about the rest.
Oh yeah, the bottom part. This is a little photo album it's sitting on.
It's what?
A photo album, a very small photo.
1950s photo album. You got on
Really?
Yeah, a little green thing.
yeah.
And then the base I made, my neighbor across the street was into woodworking, and I went over there one day and asked him if he had some wood, and he came up with this beautiful zebra-like mahogany of some type. And we turned it on his lathe, and he finished it for me, and it was. There's wires all open inside, and the guts of the things are pretty well gutted out. So you had to destroy most of the inside, but the outside looks.
I got
So do you sell these?
I don't. And,
I think I knew that, but
yeah, and you know
I'm
what?
gonna ask the question anyway.
Because to me, I have to have this energy to create something.
Uh-huh.
And I have made two for one lady, one of our acquaintances. She wanted two, so I made
Two of those
two of the
telephones.
yeah.
Uh-huh.
And she had the telephone.
But anyway, I think of it more as relaxing. If I had to do an order, I probably could do it.
Yeah,
Like I told Melanie, I need to make my mom one. She didn't have one of these.
yeah.
And she keeps saying, I really do like that.
Yeah.
I mean, really, really cool.
Yeah, I remember all those things.
It's a conversation piece.
It is, and this is the first lamp that he made for me. He's made lamps for my daughter and son-in-law. Like, she got all of them. And I finally said, I think you really need to make one for me. And I'm a photographer, so that makes it even more special.
Yeah.
I'm not
definitely.
professional, but yeah.
No,
so-
but that's
yeah,
perfect.
so he came up with that idea. I'm like,
Very
yes,
cool.
I'll get my own lamp.
Yeah, I think it's great just to see, what different talents are, different skills are, and again, amazing work. And you think of everyone will sit and say, well, I can't do this as well as I used to be able to, or I can't. Look at what you can do, and you may open a lamp business soon. So it's like you're gonna have a bunch of orders after this on Zoom. So
Yeah, the main thing on this, it took me a long time to make these. I work on them for hours, days. So, but I get it done. I'm a little shaky sometimes, but
you get it
I
done.
get it done. So.
Yeah.
But you also had to use some fine skills, which are hard for Parkinson's.
Yeah.
So,
That's the old screwdriver with two hands. sometimes.
yeah, so
Depends on the time of day too.
but still kudos to you. That was it's really cool because some of that's more tedious when you have Parkinson's, which is part of why he had stopped working, because his fine motor skills just were not there to be able to work. So that's awesome.
To switch gears a little bit, we talk about, what are some interventions that have been helpful for various people and in different ways. Wayne, I'm really intrigued by your experience recently with physical therapy. Most folks have gone through physical therapy for different reasons, to work on your balance, to work on your gait, to work on your fine motor skills. Wayne has had, a number of different surgeries on your ankles and on your arm and different things. And, maybe you weren't quite getting to the place you were hoping to be until recently. You want to kind of share those experiences? And we actually have a video before and after of Wayne walking after one of the physical therapists had worked on him. But you want to kind of share your experience with that?
I'd been told that physical therapy was available. And the first person I went to just took what I consider a normal routine of exercises that anybody would have to do that was having issues. And I finally got involved with the folks at Power Back, and one young lady was the one who set the foundation for my balance, my gait, my shifting of my hips, my firing of certain muscles that weren't firing properly. And all that was because of ankle reconstruction that I'd done in 2015, which didn't work out exactly right. So I favored that foot, which meant when I was stepping off, I was trying to plant this foot down quickly, which caused me to be shifting my weight inappropriately. And I've been going on my 12th week with Power Back, going 3 days a week. And it has helped me tremendously to get not only make it easier to walk, because I'm not using 14 parts of my body and all my upper by strengthening everything else to keep my balance, to keep from tumbling over like a redwood. And it's made a tremendous difference. And my wife, I think,
You want to do the before and after videos?
It's not just the Parkinson's that impacts gait. I mean, the really massive ankle reconstructive surgery that maybe didn't go perfectly. He had, what I would call a kind of a wonky gait, really hard to classify, hard to fix. And so besides the traditional therapy methods, one of the therapists started doing what's called myofascial release on this really deep tissue massage, and really went in there and broke up all the scar tissue in the ankle, and it's been amazing. And physical therapy is, as Chad will tell you, is another amazing physical therapist we work with. It can really make the difference, if you get the right people looking at you. So you can see the before and after. So you can see that left leg.
Yeah.
that's what I'm seeing now.
Wants to swing so wide. See that ankle.
And let me say this, we had a lot of falls. I mean, one fall so serious that he severed his ulnar artery, severed his ulnar nerve, and he was on blood thinners when this happened, and we live out in the country. It's very serious. We've now been 12 weeks since he's been coming without a fall, which is huge.
Wow.
And it wasn't due to the shuffle, but that's walking in the driveway this weekend.
Oh, that is.
That's amazing.
Yeah.
That's 12 weeks.
Yeah, 12 weeks is Friday. Wow. But it's the, he's been in a lot of therapies.
The other way. Wayne, did you have pain before?
Yes,
I mean, with your gait, is it reduced your pain?
it's gone.
And he's been to a lot of physical therapists over the years. And probably 2 years ago, Dr. Iyer kept saying, we have this group and they'll come to your home or you can come here. And it just wasn't right. And after so many falls, and Iyer having a conversation about safety, because Wayne's a retired highway patrolman, so he's big into safety. And it had to be his timing, and it was his timing, and he said, I need to start this. And it's been absolutely incredible. Life changing. Yeah. And this is a commitment for us because we're an hour out. So
And y'all are the ones that were an hour away.
we're an hour away, and then we come here for an hour and then go back for an hour. And by the time you get ready in the mornings, sometimes that can be slower than others. And then you get home. I mean, it's pretty much a full day for us, 3 days a week, but it has been life changing.
And just seeing the reaction and the response that Wayne has had from obviously not only the gait training, but the myofascial release work. It starts making me think about other patients who've had significant orthopedic procedures that are impacting their gait in so many ways beyond just the Parkinson's, and how this can work. I mean, the myofascial work can work on posture for the hunching that a lot of people get. It can work on the low back where a lot of people develop those issues. So really, I've learned a lot from the physical therapists and in terms of what they can do to help our patients. So what a wonderful video to see. David, one of the things that always strikes me about you is your ability to motivate others. Every year at the Parkinson's Walk, they call your name out that you've raised the most money, you've done the most to, for the community, and with the parties you throw. I mean, how do you see your role in motivating others? Was that some natural thing that was within you, or?
Well, we were at a meeting that the Parkinson's Association was putting on at the JCC. And we just decided then early on that we need to find something to get involved in to help the cause. And we picked the annual walk that they have. So we put together a team. We've done it, I think 4 years.
Except for COVID.
Yeah. 4 years. And we've always been the top fundraisers and the most people and the
Makes
group.
it stressful for next year.
The group, we have the people in our boxing group, we got people I play tennis with, and our friends that all involved, and we've been having a party the night of the
of the walk, an after party, and it's been really great. I mean, people get to socialize, and a lot of people don't go out that often, go to parties, and yeah, you guys were at one of the parties, right?
We were at your Christmas party.
Yeah.
Christmas party, yeah.
And
Y'all have no TVs in your house, right?
That's right.
Elementary, right?
I remember that.
Yeah, you've got a lemon tree, we have no TV.
I have, and it's blooming beautifully.
We have a lot of lamps.
You could have lamps.
I mean, you gotta do a lamp with little TVs on it. Yeah, we enjoy it.
Yeah.
It's a lot of fun.
I think there's so much to be said about purpose. We all need purpose. There's sort of a young onset Parkinson's group that has kind of grown out of my patient panel, if you will, and that they started meeting here regularly. But one of the young ladies, I think her son had just graduated and gone off to school or gotten a job and empty nester, and she's saying, "What am I going to do with my time now?" And I need something to do. She was getting kind of down about things, and I said, "Well, everyone needs purpose. We don't have a young onset Parkinson's group. Why don't you start it for us?" So she did, and we helped her get connected with maybe 10 or 12 other people. David was one of them, and they all kind of met up here and thought about some fun things to do. And I think what's really been helpful is these are people who have never felt comfortable talking about Parkinson's because they try to go to a support group, and here's someone in their early to mid 40s, and they go to the support group, and the comment is, everyone there looks like my grandfather. This isn't my peer group. I don't fit here. Where do I go? And there never has been a group, for a lot of those folks. I think she made the comment. She said, "I thought it was just me and Michael J. Fox." But to come to a group where suddenly there are 12 or 15 other people in the same situation. These are folks who are working. These are folks who have kids. They have deadlines. They don't have time for Parkinson's to get in the way. But now they can kind of connect. And I think David's been really instrumental at kind of keeping that group moving and keeping them together. And I think they even came up with a fun name for themselves, the movers and shakers, I think is what they call themselves. So, you got to have a little bit of fun with it. But I think it's wonderful what you do. I know just to be respectful of time, we have one more question, and then maybe we can open it up to some of the questions on Zoom or whatnot. And this is maybe more aimed at the significant others. What have you learned on this journey that you want other care partners to know that maybe you wish you had learned sooner? And maybe we'll start down with Jamie.
Gosh. I mean, at first when you asked the question, I was like, gosh, I don't know what I could have learned earlier. But then the word compassion came to my mind. Because it has certainly impacted our lives as a couple. But I have so much compassion for him going through it that that's what I wish I had understood in the beginning. In the beginning, like I said, I didn't want to tell anyone. I have a huge family of siblings, and we talk constantly, and I just couldn't even talk about it. We could talk together. He didn't talk at work. But I wish I had spent more time being compassionate towards him being the one who had it than us as a couple, like, oh, what do we do now? So compassion.
I think it's hard to know. People always say, you don't know what to do. There's not a book. There's not a guide. There's not a map for this. And you think about some of these folks that you guys have impacted with this young onset group. Had there been something like that at the time that you could have plugged into to wrap your head around it.
Absolutely.
I think that it may have kind of changed some of the things that you were thinking about then. But
and you can still normalize life. I mean, that's another thing that, you know, like with so many of the younger people we've met that we've talked to, and, you know, you were considered early onset.
Yeah.
So, but you can live, you can embrace, you can, you know, do all those things. It's just a little different path. And that's what that's what we want to say to the younger people, who, some of which still don't want to tell anyone. And, you know, I get that, but.
And some of whom who, you know, don't want to go out to dinner, they don't want to go to parties because
Right.
people might notice that their hands shaking or they're
Yeah.
spilling their drink. And I think you give them a safe place to go and have fun. And so, I mean, you're doing a lot for them.
But, you know, do I have time to say this?
Sure.
Okay, because when David first came to you, the psychologist you worked with
Mhm.
that was with you,
Yeah.
remember, said to you,
Yeah, well,
Okay.
I didn't know whether to tell people I worked with.
Yeah.
That was a big concern. She said, well, do you think your symptoms are noticeable? I said, I'm not real sure. She goes, well, they are.
Gee, thanks.
And do you want people to kind of guess on their own what's wrong with you, or do you want to let them know? And so I'm a big believer, if I was going to do it over again, in my work environment, I would definitely let people know.
Control the narrative. And,
Yeah.
you know, and you know, from an HR perspective, you know, Parkinson's is protected by, you know, the Americans with Disabilities Act, which states that employers have to make reasonable accommodations. If they don't know that you have Parkinson's, then, you know, ooh, I think he's been drinking again, we're gonna
well,
fire
and
him.
that's what she said to David.
Yeah.
Yeah.
She said that's what people are going to assume.
The last job I had, I was in Florida in a conference room like this, and I had to fill out some paperwork. It was a fairly new job, and I had told anyone I worked with that this company, they had Parkinson's, and I was waiting to get in to see you. I had just moved back to Charlotte, and it was going to take a couple months. And I was at the conference table, and I was filling out some forms, and I just couldn't even write anymore. It just hit me, and I wasn't on any drugs yet.
Mm-hmm.
May I say something?
Please.
I find obviously it's a challenge we all have, but I assert and pile on extra challenges for myself. I'm going to be 78 next month, and what I do is my goal at Rocksteady Boxing is to be the oldest person in the group, but the number one person in that group.
Good
So,
for you.
and it pushes me, and it pushes the people that are 20 years and 15 years younger than I am to say,
Wow.
you know, this guy's beating my pants off me, you know. So that's one thing I do. And as far as when I see somebody walking in Harris Teeter or where it may be and what it may be, if I think they have Parkinson's, I don't let them get away. It's like I'm getting paid a commission for bringing in
Diagnosing
people diagnosed. I can tell by the walk. We all, you know, I'm not saying anything that none of us have heard before, but I'll have a couple lines like, "You look familiar to me. Do you go to Rocksteady Boxing?" Well, they have no idea what it is. And I'll say, "No, what is it?" "Oh, it's a place where I box and stuff. And, oh, by the way, I have Parkinson's disease, and this is why this fits in with me," and stuff like that.
Yeah.
Wow.
I just try to push myself. You push yourself to making lamps and things of that nature. You walk, you do this. My thing is, you know, challenge them before they even know they're going to be challenged or what the challenge is. And it's helped me a lot along the way in the sense of
Great.
just going to the athletic things. I was an athlete when I was younger, and I'm not going to stop because I'm older. And I think I see a lot of other people like that and do that. It's comforting to know other people are fighting. And
Wow.
You know, I got Parkinson's. You know, the hardest part about Parkinson's for me is I'm single. You know, when I walk up to her, hey, I'm old and got Parkinson's, and what are you doing tonight?
Well, that's great. And thanks for sharing that. And I think you're right. I mean, I think it's a testament to you've seen what the physical activity can do for you. And you know, when you see folks out there who don't do it, you know, you want to go and shake them and say, come on, you know, life can be a lot better if you do some of these things. So I applaud you for that.
This is not my date, it's my daughter.
Well, Suzanne, what have you learned on this wild ride that you want to share with folks?
You know, what I've learned is something that we all hear, you've heard it, and you feel like you're doing it until you realize you're not. And that's finding a balance of self-care. And self-care actually, I almost felt like it was a selfish mood just because, you know, it's my nature to put other people's needs first. But you reach a point where you have to say, okay, I have to do this. If our relationship is going to be better, my being attentive to him is going to be better. I'm going to be a better person. And, you know, more importantly, I want to be as healthy and as strong as I can be. So, and if I'm needed to do something different or more, then I'm available. But getting self-care and saying and feeling good about it, it's okay to take 30 minutes and do this, or an hour and do this, and not even being noticed that you were doing it. So, I mean, Wayne's fine, and he never had restrictions on my doing that. It was just something that I had that I felt like it was selfish to do. And so that's been a real help, especially over the past, I retired a couple of years ago. So in a couple of years since I retired, that's been, I think, really big, at least on my end.
I think we always tell folks, you know, like when you get on the airplane, they always say you have to put your oxygen mask on first before you can help everyone else. And so, you know, I tell, you know, our care partners, you know, don't ever feel guilty. Don't ever feel selfish for needing, you know, that 30 minutes or that hour in the morning to go get your exercise, to go get your head on straight, because, you know, you've got a big job ahead. So, you know, we all have to take care of each other. You have to take care of yourselves. So I think that was great advice. So
Easier said than done, though.
You're right. You're right. Well, Melanie, what are your secrets to that you want to pass on? What are things you learned other than planning great trips?
Well, it's a really hard question for me. I agree with Jamie that compassion is definitely something that I've learned. Not only compassion for Kirk, but for others. In any situation, I think I tend to notice people more and try not to judge people in any ways that they might be in, because you don't know what they're going through. And you have no idea what might have just happened, even in their life or in their day. So I think that has helped me. Kirk was diagnosed in 2009, and for probably about the first year, he didn't tell really anybody. Some of my family knew, but he didn't really want to share it with his mom, although she figured it out. And then later on, she's like, well, why didn't you just tell me? And we're like, well, we didn't want to worry you, type of thing. So I think for anyone that maybe getting Parkinson's, I'm with David. I think admitting it or telling others more quickly might have been easier. I don't know. I felt like for Kirk, I didn't want to push him to tell anyone, because I wanted to give him to have the time for it to sink in and for him to do whatever he needed to do with that knowledge. And maybe that's good. Maybe that was the best way to go, because that's what we did and it worked. But looking back, I don't know if it would have maybe been easier at the time if he would have told his mom or dad or whatever. But I also agree with Jamie that this isn't something I would have chosen for Kirk, but I think we're better for it because we've we've learned so much about life and about others.
Well said. I think, we talked about, David made the point, when the symptoms become noticeable, people will draw their own conclusions, and, that's usually the time where you probably need to tell folks. But, it's obviously the situation where, if there's a death in the family, we always say, don't make any major changes for a year. Don't sell the house. Don't move to Florida. Don't do this. Just take a deep breath. Let's get through the first year, and then figure out what you're going to do. When you get diagnosed with something, it's much the same way. I had this conversation yesterday with the new patient, and it's been 3 months from the time of the diagnosis. He's still sort of in that learning phase, soaking it in, so to speak. And I think what people learn, you get through the first 3 months or the first 6 months. By the time you get to the first year, you realize, what? All the things that I've been doing, I'm actually better than what I was when I was diagnosed, because I'm exercising more, I'm doing all these things. And you also gain the confidence that, the other shoe hasn't fallen. That's the people always say, well, when's the next thing going to happen? And, next month, am I going to start falling? Or next month, am I going to start choking? Or is the tremor going to spread to the other side? When is that going to happen? And I think as you start to take control of this and start doing all those proactive things, you realize by the time you've gotten through the first year after diagnosis and you're still okay, and maybe even better, I think that's where that confidence comes, because, sharing news like that with loved ones early on, where you're not even sure, for men, it's especially hard to be vulnerable and to not have the answers, and to go and tell your mom you have Parkinson's and I have no clue what to expect, the next 10 years. And that's not a good feeling. And I think it takes that time for people to be able to wrap their own head around it. So, I think, there's never the right or wrong time. And we had the discussion around, well, should we tell the kids? And that's a different situation. So I think at the end of the day, when symptoms are noticeable, probably needs to have a conversation, because they'll draw their own conclusions. And ultimately, people just want to know you're okay. And that's really the way it is. But I really want to thank all of you for being here. This has been a great discussion and wonderful dialogue. Thank you for sharing. I know it's not always easy to share these sort of details, in front of strangers and also on the internet. So thank you very much. And I think, do we have questions that are up on Zoom? I know we've had a few that were submitted. I printed the list that was submitted earlier, and I can start there while people are kind of getting their thoughts together. One question, I'm kind of new to this malady. I'm not sure what to expect. I hope we've sort of covered a lot of that. It's, you don't have to expect anything, be active, stay active, socialize, be connected, don't crawl into a shell.
Huge stuff.
And you're going to be okay. Look around the table. I mean, people here have had Parkinson's for years and they're still great. So you can keep doing great things, and that's what you should expect from yourself. We talked about foods to avoid with carbidopa, levodopa. I mean, the literature will tell us that protein can interact with the medicine, and maybe it doesn't work as effectively when you have protein in your gut at the same time you've got the medicine there. They get absorbed in the same place. So some people notice when they have a protein load that their medicine doesn't work. It's not as common as the package insert will make you feel. It's rare, but it does happen. But I still tell most folks, just take your medicine when it's time. Don't worry about the meals, because you end up being more neurotic about it, and then you can't figure out what time can I eat, when can I take my pills, and you start becoming a slave to this disease. So I tell folks, just take it when it's time, and if we notice the pills don't kick in, we'll make an adjustment. So that's the way I usually consider it. There's a question about there's a relatively new ultrasound treatment for Parkinson's tremors. It's an MRI guided focused ultrasound treatment, and it's marketed as incisionless surgery. So nothing actually penetrates your skull. They aim an ultrasound beam at your head, and that beam goes into the brain and it burns a tiny hole. It creates a lesion in the brain where the tremors come from, and is done in an MRI machine. Again, there's no incision, but you still have to have a frame screwed onto your head. So there is some local anesthesia done, and the frame is kind of screwed on. The good and the bad is that, well, nothing penetrates your brain. At the same rate, though, it doesn't come without, possible penalties. So number one, you can only fix one side. Because if you do this procedure on both sides of the brain, it'll cause really serious balance problems. Number two, because you can't always control how big of a lesion you create when you do the ultrasound blast, if it's a little bit too big, you can have some pretty significant problems with balance and slurred speech and even swallowing. And so, while a number of people have had it and have done well, it doesn't address any of the other Parkinson's symptoms. It only fixes tremor on one side. But the downside, I have a couple patients who've gone to other centers in other states to have the procedure done. They traded in their tremor for a walker. That they can't get rid of because it messed up their balance so much. So I still believe that the deep brain stimulation surgery, where we implant the electrodes in the brain, is a superior procedure because we can control it much better. The downside is you got to have hardware in there, and not everyone wants that. So I think the ultrasound is a great treatment for people for whom the DBS surgery, there's a contraindication, or maybe because of some heart problems they can't have surgery or whatever it is. So it is an option, but it doesn't come without possible penalties. One person made the comment that I think we've all kind of emphasized here. Please mention the need for movement is the most important therapy. So keep moving. So yes, absolutely. Thank you for that comment, whoever submitted that. One question is, are there techniques to overcome freezing? Freezing is a situation where gait freezing or freezing of gait, when people are walking and their feet get stuck to the ground and they cannot pick it up. It just sticks, and no matter what they do, they can't make it go. There are some visual tricks that you can have. There's a walker that projects a bright red line on the ground, and so if you look at the red line, you can kind of trick your brain into stepping over it, and so that can break the freezing. Other people can take a step backward and then their foot will go forward, or they go sideways and it'll go forward. This morning there was a patient here who was having the freezing and she couldn't get her foot to pick up to go forward. I said, well, don't try to go forward, just march in place. And so she started marching in place, and then she could start walking. So something just has to break that freezing up. Chad, you may have some ideas on gait freezing. And
I have them count out loud. Sometimes that just kind of takes their mind off it for a moment. I don't know where you see the freezing. I see it at thresholds, any change of surface,
the
carpet. Yeah, anytime you get in a congested area, it kind of seizes. A threshold of any type, or even if you go from hardwoods to carpet, I'll see it. So, and I try all sorts of things, and sometimes they work and sometimes they don't, but I just keep trying. The walker you're talking about is handy. Now it's fairly bulky. It's fairly bulky, but it does seem to work the majority of the time. But it is a contraption, that's for sure.
It's definitely there's a different trick that works for every individual. Some people it's a visual thing. Some people it's an auditory thing. You can entrain your gait. If I tell people, think about your favorite song and get that rhythm in your head, try to move your feet to the beat, because freezing happens to very natural movement. It doesn't happen to unnatural movement. So I'll have patients who can't walk forward because they're freezing, but they can walk backwards all day. So when you do things a little bit differently or in a strange way, you can break the freeze. So great question. Unfortunately, more medicine doesn't always help that. So we got to be clever with how we attack it. I think the last question here is, what's the best way to deal with fluctuating blood pressure? So much in Parkinson's, we focus on movement. It's a movement disorder. Well, yeah, it certainly affects the motor tracts in the brain. But there are a lot of invisible symptoms that are even more disabling. We've talked about the depression, the anxiety, and those things, but blood pressure drops can be really challenging for some people. So when people stand up, their blood pressure will just tank. And the net result, they get very dizzy, pass out, they can fall or get really injured. And so the first thing we do when that happens is we look at their medicines and say, okay, are they on anything that lowers their blood pressure? And if so, let's get rid of it. Let the blood pressure run up higher because we know it's going to drop at times. We talk about hydration. We've got water everywhere. We talk about 64 ounces of fluid a day before dinner time to kind of keep your tank full. And at times we even add medications to raise the blood pressure. Because if we know it's going to drop 30, 40, 50 points when you stand up, then it's okay. We want it to run too high because when it drops, we don't need you to pass out. So the concept is permissive hypertension, as we call it. So, obviously we don't want the blood pressure running up into the 200s. But if someone's at 150, 160, I'm good with that because it's probably going to drop, 50 or 60 points at some point. So again, it can be a tricky problem. And when it's really fluctuating, we'll often work with the cardiologists and get their input as well. But this is a pretty significant challenge for a lot of people. So again, it's not just a movement disorder. So those were all the questions that I printed on the list you'd sent me earlier. Didn't know if there's anyone on Zoom who would put anything in the chat box.
I see a lot of thank yous and a suggestion for a session, an upcoming session that we should do on people with Lewy bodies.
Okay. Yeah, we can certainly put some thought behind that.
It's a great idea.
But
Can you repeat the question? I didn't hear.
It was a suggestion that we do another session in the future for people with Lewy body.
With Lewy body disease or Lewy body dementia, the challenge for folks that have Lewy body dementia is a separate disease. It's separate from Parkinson's, and Parkinson's doesn't become Lewy body dementia. It's a completely different disease. It looks similar. The differences are that people with Lewy body disease, they develop pretty significant cognitive changes and hallucinations and big changes in their level of alertness very early. And maybe after a couple years, they might develop some tremor or some slowness or some stiffness, but their movement problems never become as bad as the cognitive issues. And that's really where the big issues lie. The challenge there is that folks with Lewy body disease are usually misdiagnosed with Alzheimer's or Parkinson's or something else, so that there's not really a support group for folks like that. It's just very often misdiagnosed. So I think it's a great point. We'll put some thought behind it. And the challenge becomes that some people with Lewy body disease, the fluctuation in their cognition is so much from moment to moment that they may not tolerate being in a support group environment, but the caregivers certainly need it. So we'll definitely put thought behind that.
I got a question.
Yes, sir.
So the DBS surgery, they are real careful that they hit the exact spot that they need to hit. Are there different spots on the brain that different symptoms are affected?
Yes, absolutely.
Like you take care of your tremor, but if you got a problem with your gait, that same spot's not going to help.
Correct. So with DBS, there are 3 places in the brain that we can implant. For people who only have tremor, we implant the area called the thalamus, or the VIM nucleus of the thalamus. For most people with Parkinson's, we implant the subthalamic nucleus, the STN. It's a different area because at that spot, you can influence tremor. You can also improve the quality of movement, the slowness, the stiffness. You can target some of the dyskinesia. And then there's a third target called the globus pallidus, or the GPI. And so for folks that have some cognitive issues and maybe have more dystonia and dyskinesia, you can target that area more safely. But, and so again, Wayne, you know where yours is, and I'm assuming you do. It's in the thalamus. Wayne's is in the thalamus because his was tremor. Yours is in the STN, or subthalamic nucleus. So you're exactly right. You can influence different symptoms by implanting different places.
Okay.
We have a question about food. Any thoughts or evidence for a vegetarian and vegetable heavy keto type diet and Parkinson's?
There's no consistent data on the right diet for Parkinson's. They've looked a lot at the keto diets. I think I know my patients, for example, who are diabetic. I see big fluctuations in their Parkinson's symptoms as their sugar levels are up and down, or their insulin levels are up and down. So in those situations, when people have gone on a more keto friendly diet, their Parkinson's symptoms tend to calm down as well. I think that's more because any other symptom, we see all the time people with Parkinson's, when you get the flu, when you get a UTI, when you get pneumonia, all your Parkinson's symptoms blow up temporarily. It's just the extra stress. And so that may be what we see, but independently, there's not been one diet that's been validated that this is what people should do.
Thank you.
Thank you all.